jointly developed by Smartee and Professor Shangang orthodontic team. S9 and S10 are important parts of S8, S9, and S10 mandibular repositioning technology of Smartee GS product series. S9 is the clear version of maxillary bite plane. In the palatal of the maxillary anterior teeth, a sheet plate is made. Its end edge fits with the palatal in a slope extension manner. The S9 bite plane tissue surface is vacuolated. If the bite force is too powerful, a reinforcing block can be placed to resist the bite force. According to the bite plane surface structure, S9 is divided into two types, namely anatomical type and non-anatomical type. The anatomical bite plane suppresses occlusal marks on the surface, which can advance the mandible moderately. There isn't any occlusal marks on the surface of non-anatomical bite plane. The mandible can slide freely. The indications of S9 non-anatomical bite plane include Class 1 molar relationship with deep overbite of straight profile and mandibular positioning originated prognatism malocclusion, not suitable for forward positioning due to facial profile. The indications of S9 anatomical bite plane include mandibular retrusion caused by condylar resorption and mandibular deviation caused by condylar asymmetric resorption with prognatism malocclusion. The mechanism of S9 bite plane is to open the occlusion of anterior and posterior teeth vertically. Take the straight profile with deep overbite as an example. The clinical procedures include opening the occlusion to expose the lower anterior teeth, aligning and intruding the lower anterior teeth, contacting the posterior cusp and fossa, and finally adjusting the occlusion. Mandibular repositioning and occlusal reconstruction are performed simultaneously. S10 is the clear version of anatomical occlusal splint for maxillary posterior teeth. On the occlusal surface of the maxillary posterior teeth of the aligner, an occlusal splint is made. The occlusal surface is provided with occlusal marks corresponding to the lower dentition. The indications of S10 anatomical occlusal splint include mandibular positioning originated retrognatism malocclusion, some of mandibular deviation caused by condylar asymmetric resorption, and condylar asymmetric acromentition. The mechanism of S10 anatomical occlusal splint is to correct the mandibular position. Take the mandibular positioning originated retrognatism malocclusion as an example. Its clinical procedure includes forcing the mandible to retrude to the anterior edge-to-edge position, forward maxillary traction with RPHG, distalizing the lower molars and moving backward whole lower dentition. After removing the occlusal splint, the anterior teeth return to normal overbite and overjet, and posterior cusp-fossa contact can be achieved. Orthopedics and orthodontics are carried out simultaneously. S8, S9, and S10 are the technical system of mandibular repositioning in Smartee GS product series. By opening the bite vertically and correcting mandible in 3 dimensions, S9 bite plane and S10 occlusal splint play an important role in mandibular repositioning and orthopedic treatment.